Hi, it's been a while. It's been a busy week. N is for nitroglycerin. We're going to talk about nitroglycerin as a continuous infusion, not sublingual nitroglycerin like we use for acute coronary syndromes. So nitroglycerin continuous infusion comes in a premixed glass bottle, 50 milligrams and 250 mLs. It does not need to run through filter tubing. It does not need to run through nitro tubing, it's commonly called. It used to, and that's why it's called nitro tubing, but now we use nitro tubing for other things, primarily amiodarone and mannitol, other things, but we do not need it for nitroglycerin. Nitroglycerin in continuous infusion can be used in low doses for acute decompensated heart failure. That's a little counterintuitive, right? These patients come in, they're oftentimes hypotensive already. And so it's a little bit tricky, the idea that we might use something that will lower blood pressure even more. But the idea is that we are doing something or giving a medication that will decrease preload, potentially decrease afterload. So we give a low dose, 10, 20, 30 mics per minute of nitroglycerin to decrease the work that the heart has to do to maintain cardiac function. The idea here is that if we can decrease the work that the heart has to do, it can do its job better. And so we're giving the patient's heart a chance to take some of the stress off and allow it to do the job it's supposed to do. And so oftentimes in acute decompensated heart failure, just decreasing the preload and afterload just a little bit with a little bit of low dose nitroglycerin will allow the patient's heart to kind of take over and do its thing. And so sometimes that's all those patients need. The other indication for nitroglycerin that we oftentimes see is in hypertensive crisis or in aortic aneurysms. In those cases, we will use much higher doses of nitroglycerin to get the blood pressure down really quickly, to cause vasodilation, cause a decrease in preload and afterload in the form of vasodilation. Again, much higher doses, 100, 200 mics per minute of nitroglycerin, again, to get the blood pressure down very quickly. And this is to decrease cardiac strain in the form of aortic aneurysms. We're trying to decrease the likelihood of dissection. And so we do that by decreasing the preload and afterload, or the work that the heart has to do. And so you're decreasing that strain in the heart. And then obviously in hypertensive emergencies, you're just decreasing the blood pressure as quickly as possible. And so nitroglycerin can be dosed very differently based on the patient that you're dosing it in. And that is N for nitroglycerin.